Hi, I'm Michael Riley, a double board certified facial plastic and reconstructive surgeon and proud member of the board of the Foundation for Facial Recovery. Today I'd like to share some of the highlights about minimally invasive and surgical interventions that can help patients suffering from facial paralysis. For those whose condition extends beyond 12 weeks, there are a variety of non-surgical and surgical options to consider.
What are the non-surgical options?
Facial palsy patients whose nerve fibers regrow abnormally find themselves struggling with conditions called hemifacial spasm or synkinesis, where the muscles on one side of the face involuntarily contract, often during times when attempting to move different facial muscles. This leads to facial distortion and uncomfortable tightness on the face and neck. Chemical denervation, the use of an injectable medication to reduce nerve input to the wrong areas, can temporarily treat these symptoms. This procedure lessens undesirable muscle activity via injection of botulinum toxin, a bacterial toxin, directly into the affected areas. The effects of botulinum toxin can temporarily treat the symptoms of spasm and synkinesis, with the effect typically lasting about 3 months.
What do these injections entail?
A small amount of botulinum toxin is injected into each of the desired areas using a very small needle. The medicine takes effect within 3 to 7 days, at which point there should be less sensation of tightness and improved symmetry. Botulinum toxin injections for issues related to facial paralysis are almost always covered by major insurance carriers. Overall, this treatment shows an excellent promise for treating the discomfort and visible asymmetries that are associated with incomplete recovery of facial paralysis.
Are there other non-surgical treatment options?
Injectable fillers can be used as an adjunct with chemical denervation to help balance facial asymmetries or to help increase the weight of the affected upper eyelid to help with better eye closure. These treatments are rarely covered by insurance.
How does a patient know if they are a candidate for surgery?
Concerns related to facial paralysis that can be addressed with surgery include a drooping eyebrow, limited eye closure, retracted position of the lower eyelid, facial asymmetry, decreased facial movement, tension or tightness in the face or neck, and speech or eating impairments due to difficulty with mouth closure. The procedure to optimize eyelid position and function will be discussed in a separate video. But here I'll discuss the 3 most commonly performed procedures for reanimation of a paralyzed or flaccid lower face, which are temporalis tendon transfer, masseteric to facial nerve transfer, and cross-facial nerve grafting with gracilis muscle transfer. I'll also discuss the best procedure for addressing lower facial dysfunction that occurs due to severe synkinesis and spasm, a procedure called as modified selective neurectomy.
What is a temporalis tendon transfer?
The procedure transfers the attachment point of the temporalis muscle from the jawbone to the muscles around the corner of the mouth. With dedicated exercises, patients are able to obtain voluntary control of the movement of the corner of the mouth, replicating a smile. The procedure takes about 2.5 hours and is done on an outpatient basis.
What is a masseteric to facial nerve transfer?
This procedure differs from the temporalis transfer in that rather than transferring the muscle itself, instead a branch of the nerve to that chewing muscle can be connected to a poorly functioning facial nerve branch. This helps power the facial musculature. The procedure takes about 2.5 hours and is done on an outpatient basis.
What is a cross-facial nerve graft with gracilis muscle transfer?
In this procedure, a nerve graft is taken from a sensory branch of the lower leg. The nerve is connected to one of the facial nerve branches on the unaffected side of the face and then tunneled under the skin across to the weak side of the face. After 6 months or more, the nerve is connected to a gracilis muscle transplant from the inner thigh that is placed on the affected side of the face, overlying the natural smile muscles. As the patient heals from surgery, spontaneous activation of the smile muscles on the unaffected side of the face will translate into movement on the affected side.
What procedure is there for patients with synkinesis or undesirable tightness?
For patients with some recovery of facial movement but significant miswiring or synkinesis, a modified selective neurectomy can help to reduce the nerve inputs that are causing undesirable movement in order to allow for the more desirable movements to dominate. A nerve stimulator is used during the procedure to carefully identify which nerve branches are generating favorable movements and which are working against the smile. Nerves that help with showing of the upper and lower teeth are preserved, and the other nerves are deactivated. This procedure takes about 3.5 hours and is done on an outpatient basis.
Where can I get more information about treatment for my facial paralysis?
Thank you for taking the time to explore options for treating your facial paralysis with me. For more information about the various surgical treatment options for your facial paralysis, please visit rileyfps.com or the Foundation's website at foundationforfacialrecovery.org.